This you could call progress.
Is this road better?
Yeah, it wasn't paved.
Fresh pavement since the last time we were here, making the trip quicker now from the city to the small town of Murrow, Haiti, where the story began 10 years ago. The road to recovery hasn't been so smooth.
In the earthquake, we lost lots of colleagues, lots of friends.
Life here in the poorest country in the Western Hemisphere was hard enough before the 2010 earthquake. It killed an estimated 160,000 people and injured more than twice that many. When the earthquake hit, the epicenter was 100 miles away. The injuries came to Murrow by helicopter and by the hundreds.
This is the hospital here. This is Sacré-Cœur.
This small town's even smaller hospital was the best hope for more than 1,000 earthquake victims. Volunteers from St. Louis and across the United States turned a tiny 70-bed facility into a life-saving tent city as the patients kept coming.
It's been almost 3 weeks since the earthquake, and now the hospital is starting to take on patients not only from Port-au-Prince.
Today, the landing zone is gone. And in this small town, the chaos from the earthquake is gone too. But this is a country still very much in crisis.
Women are dying in childbearing. Children are dying of malnutrition.
Dr. Harold Prevel is the hospital's CEO.
Name the disease. You have it in Haiti. Ask what has been done, what is in progress. Nobody would give you an answer that could satisfy any decent human being.
If we weren't here, people simply died.
St. Louis physician Dr. Bill Guile was one of the roughly 1,000 volunteers who cared for people after the earthquake. 10 years later, he's the vice chairman of CRUDEM, the St. Louis-born nonprofit that supports the hospital.
Do you worry people have forgotten about Haiti?
People have forgotten about Haiti. You know, without an earthquake or a hurricane.
But judging by how the hospital has grown, CRUDEM has not forgotten.
Doctor, when you look at this hospital and think about the last 10 years, what comes to mind?
Miracles.
Since the earthquake, the hospital's Haitian staff can now help people in ways it never could. Life-saving care for premature babies, high-tech tests, complex lab work, and Haitian and volunteer surgeons now work in brand-new operating rooms. The hospital has more than tripled in capacity and continues to grow in reputation. Haitians still come from hours away to see a doctor at Sacré-Cœur Hospital.
And this line is not unusual. There can be 500 people a day here waiting to see a doctor 5 days a week, every day of the year.
So how is this hospital successful in a country that has struggled to make any progress since the earthquake?
Dr. Dubuque from St. Louis and Carlos Ruiz. Those are the two St. Louisans who had started the dream.
Dr. Prevel believes the answer goes back to how it all started, with the support of St. Louisans who stayed committed with their resources and to their belief that Haitians should lead the way.
Our job is not so much to come in and do the work, but to work with them, improve their skills. Our job is to make ourselves unnecessary.
Supporting this Haitian hospital's work to heal and build a better road to the future.
And I see beyond of this. I see our new facility, and I even see a better country.
One of the biggest concerns after the earthquake was the thousands of people with amputations. Would they get prosthetics to be able to get around in a country with not a lot of good roads? Well, another success. The hospital also built a lab to make prosthetics on site for people. And I got to tell you, Mike, there is more to this story that you can fit in a whole newscast. We've put it on our app and on KSDK.com.
I got to see some of your video. It was absolutely amazing. And you found another successful story with a St. Louis connection.
Absolutely. That'll be tomorrow evening at 6 o'clock. A former WashU pediatrician gave up that practice and now is helping children in Haiti fighting malnutrition.
If she wanted it, Dr. Patricia Wolf could have an easier commute.
You had a pretty comfortable life in St. Louis. What made you come to Haiti and dedicate this many years?
You know, when I was 12, I decided to be a missionary doctor.
Instead, she built a successful career as a WashU pediatrician and a family. But when her kids reached about the same age as she was when she first dreamed of mission work, a conversation with them reminded her of her calling.
You have more than 99.9% of the people in the world. Oh, they didn't believe it. I go, we're going to Haiti.
That first trip was 1988, and turns out was not just for her kids.
We were all changed forever. I mean, hard to talk about it still.
Dr. Wolf quickly realized her medicine wasn't doing much good if the kids she was treating had nothing to eat. She started a nonprofit and built a factory in a converted home in Haiti and shifted her focus to making a highly nutritious peanut butter-based supplement for starving children.
They have to be rescued as soon as possible, and somebody's got to do it.
Not long after the 2010 earthquake in Haiti, Dr. Wolf gave up her practice in St. Louis to focus on a brand new factory in Haiti. Today, her organization, Meds and Food for Kids, can make 300 times more product in 1 month as they used to make in an entire year.
But the process for MFK doesn't start in the factory. Instead, it begins on local peanut farms once thought incapable of producing a high-quality crop.
Look at how many people that are working at the factory, you know, and how many farmers are able to source peanut from.
MFK not only employs Haitians, but teaches local farmers how to grow better peanuts so they can use local ingredients.
We Haitians consider MFK as a very good thing, one of the best things that happened to us during the last decades.
So this has improved not just the farmers that you rely on for your source of peanuts, but the peanut industry in Haiti.
The public health of the people consuming the peanuts.
And in a country where tens of thousands of children are malnourished, today MFK estimates its peanut butter has helped nearly 250,000 kids.
What does that sound like when you hear yourself say it?
Well, it's kind of hard to believe, actually.
Especially in a country where so many promises to help haven't come through.
This is quite the legacy. Are you proud of that?
Oh, yeah, absolutely. But I'm just the maestro of the orchestra. You know, it's all those players that were important in making the song.
And they're doing something that very few operations of any kind in Haiti can say. MFK is actually exporting Haitian-made medical peanut butter, or Medica Mamba, as the locals call it. They sell it to other nonprofits around the world. They raise money that way to help run the factory, and then donations, most of which are from St. Louis, pay for the material, the product, that they then give away in Haiti.
I love this story. I mean, this is so cool to see this local connection. And you said about 250,000 kids she's helped in Haiti.
Yes.
But as far as the exporting, how many does she think she's helped?
They're looking at over 400,000, more than 400,000 kids whose lives they've potentially saved with this peanut butter around the world.
And with your story last night and today, there really is this St. Louis-Haiti connection that's really making a difference.
A lot of them. You know, Kyle McClellan, the former Cardinal, he does a lot of work there. There are a lot of organizations that nobody really knows too much about, that they have a very genuine and long invested interest in this country, in the people.
And you were
shedding some light.
Yeah, it's so just a little bit of money down there goes such a long way. So if people donate, they can buy a lot of things.
Yes, it does. Yes.
Thank you, Casey.